Well, of course, there are many factors in play here. First of all, we want to make sure that people with MS are treated to try to prevent any further worsening over time. So its efficacy is one of the first things we look when we search for a good drug for a person with MS. But we can't also forget lifestyle and people preferences. So we need to make sure that the treatment is not only efficacious, but also it adapts to the needs of the person that has a life, an active life, family, work. So we need to play all these different points together in the decision of treatment that is right for the person. That's a very good question, and unfortunately the answer is because we don't really fully know the cause of MS. We don't understand completely the mechanisms behind the damage that MS is causing. Therefore, in some people, MS drugs, they do not work, or at least they don't work clearly as they do in other conditions. Therefore, people with progressive MS, they have less choices available for them, especially if there's no evidence of any active disease, no relapses or no new lesions on MRI. Trials are ongoing, and hopefully they will address this lack of treatment for this category of people with MS. It's difficult because obviously the disease-modifying drugs now available, they are quite strong in terms of being highly efficacious, but of course they affect significantly the immune system. This could affect frailty somehow, could make people frail, even more frail. So the only way to tackle this is to clearly monitor people on treatment regularly over time with assessment, regular visit in the clinic with MS nurses, with the doctors, MS doctors, but also repeating and monitoring blood tests and MRI over time, making sure that other medical conditions do not make MS worse, or that MS treatment do not make those other conditions worse. Exactly for the reason I said before. So drugs are now more efficacious, but they come with higher risks. Most of these risks are expected. We know, for instance, they can affect the immune system, they can reduce the white cells, they can reduce the immunoglobulins. These are all factors that can increase the risk of having infections. So we know that we need to check this over time. And obviously, some drugs are very new. So we don't have a long-term follow-up of these drugs. So we still need to keep monitoring people on these drugs to prevent unknown potential side effects that are going to become available for us in the future when there will be a few years of using of that particular drug.